For me and my classmates, 2011 is a very important landmark year. It was 50 years ago, in 1961, we joined the medical college and started our journey together in the learning the art and science of medicine. The first day we entered the portals of the Trivandrum Medical College, Dr. Thankavelu, then the principal of the medical college, welcomed us to the fraternity of medicine. We were 120 students selected for the Trivandrum Medical College and 50 selected for the first batch of the Kottayam Medical College. As the Kottayam Medical College was not yet started functioning then, the first batch of Kottayam also spent their initial years in Trivandrum. Our 1961 batch will have a get-together in September of this year in Trivandrum Medical College, the place our journey started 50 years ago. For 2 days, we will stay together, reminiscing the years gone by and changing and exchanging the changes that came in our personal and professional lives. I still remember a speech from those days delivered by the Venerable Dr. C.O. Karunagaran, the founder of the first medical college in Kerala. He, at that time, had spent half a century as a physician and as a doyen of the medical education in Kerala. Ancient medicine was often based on magic, rituals, and misconceptions, he told us. But in the previous 50 years, he said he witnessed medicine making more progress than it made in the previous 500 years. In those 50 years, he reminded us that penicillin was discovered, vaccines against smallpox, yellow fever, diphtheria, whooping cough, tetanus, and polio saved millions and millions of lives. Endotracheal anesthesia made surgery ever more easier and safer. The first blood transfusion was started in the Cook County Hospital in Chicago in 1937, which was copied all across the world. Malaria, typhoid, tuberculosis, and many, many other tropical infections were effectively treated. Diabetic patients no more faced slow but certain death because insulin was discovered. He wished us well to pursue an exciting career in medicine for the next 50 years or more. Now, 50 years later, in 2011, when we look back, it was an incredible journey. In 1961, other than our eyes, ears, and hands, what we possessed to make a diagnosis at our disposal were our stethoscope, an otoscope, a stethoscope, an ophthalmoscope, and few blood tests and an occasional X-rays only. Today, we have CT scans and MRIs which can probe into the innermost recesses of human body to detect the diseases. In 1961, very few sulfur drugs and four antibiotics that were all we had to treat infections. And if the bacteria were resistant to these too few antibiotics, microbes won, we lost, and the patient's fate was sealed. Today, we have 165 types of antibiotics to treat infections. Occasionally, if we come across a new bacteria not susceptible or resistant to all these antibiotics, it will be an international news on the television the next day. In 1961, the only time a doctor dared to tamper with the coronary arteries, those are the arteries inside the heart, was when he was working on a dead cadaver in an anatomy dissection hall. But today, in most major hospitals, every day, coronary arteries are surgically repaired during heart surgeries. In 1961, it was the year American Heart Association for the first time endorsed cardiopulmonary resuscitation, CPR, for cardiac arrest and instructed physicians how to perform CTR. Again, it was only in 1967 the first mobile battery-operated DC defibrillator was used in the Victoria Memorial Hospital in Belfast for a patient following a cardiac arrest. Those were great stories those days in the newspaper. Today, in any bus, train, or plane, there will be enough non-medical people who can perform CPR successfully. In any medical student or a nurse, or in many towns in America, policemen could perform advanced cardiac life support as well as electrical defibrillation of the heart. Angioplasty, the surgical technique that widens the narrowed blood vessels in the heart, would have sounded like a science fiction in 1961. But an average day, an ER physician refers 5 or 6 cases for this procedure. In 1961, if kidney failed, death was certain in few days. Today, patients with kidney failure can be kept on dialysis for years as they wait for a kidney transplant. Those heavy metal large tubes we push through the openings in the human body to look into the rectum, into the stomach, into the lungs, and many other cavities, those frightened not only the patients, but even the doctors who push them too. But today, during endoscopy, through a long, flexible, narrow tube, we can examine any hollow organ in the body with easiness and the least danger. We can do also keyhole surgeries through these small, narrow tubes. It was in 1967, there was a news in the newspaper we read that a South African surgeon, Dr. Christian Bernard, transplanted the first human heart. Today, most organs except perhaps brain can be transplanted very safely. Even human face is transplanted following severe burn injuries in several major centers. Many procedures done today routinely were beyond our wildest imagination in 1961. Today, a radiologist can pass a catheter through the leg and go into the arteries of the brain and unclog the clot in those brain arteries or stop brain hemorrhage. Small microsensors, when it is attached to the skin outside the body, it can give the measurements of blood pressure, pulse, cardiac output, oxygen saturation, pressures inside the different chambers of the heart, and many more. Cardiologists today can implant a tiny computer chip inside the heart, which can diagnose, analyze different cardiac abnormalities, and when needed, they can give an electric shock to restart the heart if the heart goes into cardiac arrest. Patient today can swallow pills in tiny, small pills with the cameras inside, which will give the precise pictures inside our gut for hours. We saw all these things happening with our own eyes during the last 50 years. Robots, that is the artificial electromechanical machine, which is guided by a computer and often looks like a human being, is another important thing. In many hospitals in America, robots these mechanical artificial doctors take the first rounds before the real doctors arrive. There are 1,400 hospitals in the United States. Robots do heart bypass surgery, prostate surgery, hip replacement surgery, and many, many other long, complicated surgeries. During surgery, Robert's hands are guided by a surgeon who is sitting a little far away from the patient and who guides the hands of the Roberts through his computer console. When the Robert's hands are often more steadier and precise, and of course, those hands never get tired. We will have a glimpse into the medicine that is likely to be practiced by the doctors of our children and grandchildren's generation in my next week's telecast. This is Dr. I.P. Thomas from Chicago. See you again next week at the same time.